All right, today, so we're going to be looking at unwinding the soft tissue, muscle, and fascia. And we're going to be doing it by taking a shortcut. We're going to unwind the Golgi Tendon Organs. And these are neurosensors that greatly influence muscle tension. So Golgi Tendon Organs are generally located in what's called the musculotendinous junction of each muscle. And it's the part where the muscle and the tendon join. These are often located near the attachment or near their attachments to each bone. Today, we're going to be working on a big musculotendinous junction at the calf, and this is where the gastrocs and the soleus meet to become what is known as the Achilles tendon. So by unwinding and releasing into the musculotendinous junction, we're going to take a shortcut in releasing tension through the whole of the muscle, as well as tension through the fascia, the deep fascia. And this is going to get us a release down into the foot and into the plantar fascia, as well as into the lower leg. So starting here in prone, we're going to take a look at the anatomy of what we're working on. And go ahead and flex your calf again, the other way. Okay, and so when she does that, we can see the gastroc muscle, go ahead and flex again, popping out. And there's two heads to the gastrocnemius, and it then comes down into what's called the musculotendinous junction, which is right here, and that is going to form into the Achilles tendon, along with the soleus muscle, which is sort of below and right behind the gastrocs here. So we can absolutely apply the technique and unwind the musculotendinous junction from this position, but we're going to do it another way. I'm going to have our model flip over, and we're going to do it from a supine position, and we're going to be using her weight, to do a lot of the work for us. Okay, back in supine, the first thing I'm going to do is a little bit of an assessment to just test the range of motion here. So I'm going to dorsiflex the ankle, which means I'm taking the foot this way, and that'll give me an idea of just how much length I have in the back of the leg. So for mechanics, I'm going to be working from underneath. I want my hand to be in a very relaxed position. There's just going to be a slight arch to my fingers. My arm is going to be on the table. My elbow is going to be slightly off. That way I can use the table as a fulcrum. And in order to exert pressure up, I'll just be pushing my elbow down. So coming into the musculotendinous junction just below the gastrocs here, and I'm just going to push up a little bit until I feel a decent engagement into the tissue. And then I'm going to hold my pressure there and wait. So after a while, I feel the tissue begin to sort of move or dance under my fingers. And I'm just going to follow that dance. And it's pretty slow right now, pretty subtle. And as I'm going, I'm working my fingers down just a little bit towards the Achilles. And still a very slow rotation, following type of motion. And that's it. It's pretty gentle. That can often be a very tender area, so be gentle with it. And there we are, a little bit more range of motion.